Hi there, this is Damian David with Healthcare Triangle. Welcome back to Week in Review. This is the 13th week I've been doing this, and I think I'm going to tell you next week, I don't think I'll have the crazy corona here. I think I got to get it cut. It's been a long time. It's kind of driving me crazy. So, anyway, the world continues to reopen. That's what you're going to see and hear about in the headlines. And then I'll jump to a conversation I had with our own Ryan Summers, talking about a little bit of what he's seeing as hospitals and healthcare entities start to go back to normal operations or some sort of normal operations. Not so much having to cancel the non-electives. They're starting to introduce some things that they were used to before coronavirus and COVID-19 back into what their daily operations are as healthcare providers. A lot of it's around return to revenue. We're going to get a little bit more into the weeds in that with Ryan. I'm looking forward to sharing that conversation with you. And then I'll leave you with a wonderful song. It's been a request from some folks as I started to do this months ago. It's a long overdue request. I'm happy to finally record for you. So yeah, that along with some good visions. Again, as I say every week, really appreciate the work, the energy, the effort, putting yourself and your families at risks to be able to accommodate and to care and provide to the folks throughout your communities and throughout the U.S. Thank you. Let's get to the headlines. Okay, Monday, July 6th, 2020. Count that. We're into the 7th month of this. January, February, March, April, May, June, July. Okay. We've been doing this a very long time. Let's catch what we see in the headlines this week. Headline number one, 239 scientists warn the WHO of airborne transmission risks from coronavirus. Okay, we knew that it was airborne and the transmission was through breathing. That's why we've been doing some of the masks. That's why we've been standing 6 feet away from each other. Here's what they're finding. It can stay in the air and be more harmful indoors than originally thought. So poor ventilation is a growing risk factor. Keep that in mind as we get back into restaurants, we get back into tight and closed spaces, okay? Again, I can't be clear enough. I hope that you're taking the time to put a mask on, if not just for you, for everybody else you come in contact with. Headline number two, Washington State just reported 1,000 new cases of COVID-19 just today. That's 1,000 new cases today in a state that supposedly was going down in cases, okay? So here we are. Again, we're starting to see a swell, and a lot of that, I think, has to do with relaxing on some of the social distancing. So keep it up. Number three, headline, Atlanta, Georgia. Their mayor, Keisha Lance Bottoms, she tested positive for COVID-19, okay? We see her all over the news all the time. Number four, Eric Toner, a senior scholar at the Johns Hopkins Center for Health Security, predicts that Americans will be wearing masks for several years. Think about what that means. What we're seeing nowadays, folks, yeah, I'm starting to get cringes when I wear a mask in the place. People think I'm crazy. I think they're crazy for not wearing a mask. But this is going to happen for what somebody thinks it will be years. Can you imagine that? So brace, get ready for it. Headline number five. How is coronavirus affecting kids? I haven't really thought about that this much. There's a great podcast out there called Social Distance Podcast. Check it out. It's on the Apple podcast area. You should be able to find it almost anywhere that you can find podcasts. One of the folks that's regularly on that podcast is Sarah Zhang. This is a quote from her. Well, it's fittingly a miscellaneous set of symptoms. It includes a bunch of different things that are usually seen with an overactive immune system, like rashes on the palms of your hands and the soles of your feet, a swollen tongue, cracked lips, in some cases, really low blood pressure. It looks like a bunch of different things that can sometimes happen with different viruses as well. Kids sometimes just have what looks like an overactive immune system. They have almost a delayed reaction to the virus. Okay, so keep that in mind. Perhaps maybe the reason why we think that kids don't get coronavirus and COVID-19, or we originally thought that, is just maybe the symptoms present themselves differently than they do in adults. Okay, more to come on that, I'm sure. Again, check out that podcast, Social Distance. Okay, that's all I really have for the headlines this week. Obviously, remdesivir is starting to gain traction in its clinical trials. That looks like it's going to be a valid tool in the battle of COVID-19. There's a couple other vaccine attempts out there, some medications that are being utilized and tested to see if they're effective in fighting COVID-19. Nothing really definitive this week, though. So I'll leave you with that. Just the concept of COVID-19 is starting to swell again. So please do your diligence, be safe, stay healthy. Let's get to the stats. July 6, 2020, world confirmed cases of COVID-19 has reached 11.6 million cases in the world. That's compared to 10.2 million last week. 6.27 million have recovered throughout the world as compared to 5.17 million from last week. And we're up to 537,000 COVID-19 related deaths throughout the world. Last week, we were at 503,000. U.S. confirmed cases. In the U.S. alone, we're almost up to 3 million cases. We're sitting just over 2.99 million cases in the U.S. Almost 3 million cases. By the time that you view this week in review, we could very well be over the 3 million mark. Of that, 901,000 have recovered, whereas last week only 789,000 had recovered. So we're getting a good incline in recovery rates, but the deaths are up to 132,000 in the U.S. COVID-19 related alone, 128,000 last week. Okay, those were the stats. Those were the headlines. Now let's jump to a conversation I was able to have with our very own Ryan Summers, a director here at Healthcare Triangle from the Mount Pleasant, South Carolina area. He's got extensive experience working with clients. Most notably and most recently, he's helping our clients return to revenue, if you will, out of this COVID-19 and coronavirus experience and epidemic. Let's jump. Hey, Ryan, good to see you. Thanks for joining me. How's everything going?
Yeah, hey, Damien, good to see you as well.
So, hey, a lot of the conversations I've been having recently is just how hospitals and healthcare networks, how they're going to dig out from this COVID-19 thing. So what can you tell me about what you're hearing and what you've been helping people with?
Yeah, it's obviously been, one of the major considerations and factors this year, and really should be for, longer periods of time. And it's, organizations of all shapes and sizes. So private practices, one docs, all the way up to hospital, multi-hospital organizations have to figure out kind of how to approach the financials this year, how to adjust for COVID related impacts. So I'd say no matter the size or shape of the institution, based on all the conversations I've been having this year and work I'm doing to help clients, it's really the biggest piece of the puzzle that I can impart is to take a hard analytical look at really the service model in general and your corresponding revenue cycle opportunities. So I think the U.S. health system sort of has been going on cruise control for so long that we've gotten kind of complacent in the ways in which we're delivering services, with sometimes payer relationships, even with the technologies available itself. 2020 here, and we've got digital solutions available, all sorts of analytics that we can use for efficiencies. I think it's we've kind of hit a point this year where we need to start working smarter, not necessarily harder. So determining how to, factor in and incorporate telehealth services wherever and whenever you can has been obviously very important for a lot of entities. I'd say, just taking a look at charge generation and the automation that's possible there. And a lot of my work recently has been a topic of conversation. And then extending community partnerships and even the population kind of footprint has become of primary concern and importance to certain organizations, just to maximize the opportunities that they have at their disposal. So yeah, those are a few of the things that have come to the forefront and that I've been helping out with.
Interesting, yeah. So let's say we're managing a hospital or healthcare network. What are some of the ways we can prepare to return to revenue, so to say? Like, tell me about what seems like the series of work that we've been doing. Can you get a little bit more detail and more specifics, maybe?
Yeah. So, obviously COVID took hold this year and everybody kind of quickly, I think, realized that things were not just going to instantly return to normal. So we saw firsthand, the financial impacts that COVID was having on businesses, on those healthcare entities, large and small that I was mentioning, on our clients specifically. So, we started taking a look at and thinking about ways in which we could sort of help to mitigate that. So initially it was just having dialogue and brainstorming, with it and behind the scenes for our clients, what to do in the moment, in the moments when COVID was starting to have those financial impacts, and then how to better prepare for what might come in the future. So, some, depending on where you're at, are looking to sort of revamp and get back to elective procedures and elective in-person appointments, and some still aren't at that point. So, it's a case-by-case basis, but, thinking proactively about what that looks like, I think everybody, is of the similar mindset that things aren't just going to return to the way they were before. So whatever the new sort of state of normal will be, you really have to take kind of a hard look at what that means for your business. Telehealth we mentioned already, so that's part of the equation, but there's also cash management to consider. We've got changing government programs, incentives, regulatory changes, all happening and potentially coming down the road as well. So it's really planning all those things out. Where do you stand once the immediate impacts of COVID sort of are gone and we're all able to move on? You still got to address all those factors. So it's all of that. It's taking a look at, as an organization, as an entity, where are your weak points in revenue management? What do you do with your denials? Where's your service line strategy sit in relation to what's happened here this year with COVID? How's your supply chain? Do you have opportunities there? Population health? There's a ton to think about, and it's all impactful for revenue. So, I think every organization, whether you're private practice or those large hospital integrated networks, there's a roadmap out there that they need to kind of figure out. And so kind of helping to map that out with our clients has been something I've been doing, and to help them really see where they fall in the umbrella of returning to revenue, when that's going to happen, and that roadmap that they need to get to make sure that they're maximizing those opportunities.
Yeah, Ryan, I suspect Healthcare Triangle is going to keep you extremely busy this year. It's an area I see us growing. I see us excelling in, just because, I think all the consulting professional services around EHRs have a certain baseline that they're ready and are equipped to help their clients with, like, everything from what's the best way to configure your EHR to make sure you're maximizing this automation and charge. I think what you're talking about is scratching through that surface area and making sure that everything that you do really aligns more with your business operations, more how you're actually going to deliver business as an organization, which is, to me, that's way more of a professional or even more of a consulting concept than just pure EHR configuration. So I applaud you. I appreciate all the work that you're helping with our clients, and I look forward to more to come this year as people really they deal with the different nuances that their particular hospital and healthcare organization has to balance with what the government's asking them to do, what other payers are asking them to do, et cetera. So yeah, I think it's really neat what you're doing.
Yeah, you're right. I mean, it's both sides, but it is both sides of the equation. It's all the EHR, it's all the technology integration, and then it's the business, the operation strategy on the side. So all of your, all that telehealth, all the service line management, you have to pair that with what you're doing with your technology. So it's definitely both sides of the equation.
It's a different world nowadays. Well, hey, thanks a lot. Now I'm going to put you in the hot seat. You ready? I got a question for you.
Okay.
All right. So during COVID-19 coronavirus, what's been your favorite hobby?
Favorite hobby? Well, I've had a number of things up my sleeve, actually. So not being able to go to the gym, I've been doing a lot of indoor cycling. So I think I might be about ready to bite the bullet and get one of those fancy Pelotons. Yeah, we'll see. I know you're a music guy, so I will let you in on this. I have a musical history as well, and this year I started taking up the cello. So I'm still at a beginner level, but that has definitely been kind of a hobby here in some downtime.
Well, that's one of my favorite textures in orchestra, man. That's fantastic. Looking forward to hearing you. We should do one of these remote jams.
Yeah, maybe next year.
All right. Well, I'll try to talk you into it. Well, hey, Ryan, appreciate it. Thanks for taking a couple minutes with me to talk, and I look forward to hanging out as soon as this breaks and we can all get together.
Yeah, Damien, appreciate it.
is a burning thing, and it makes a fiery ring. I'm bound by wild design. I fell into a ring of fire, and I fell into a burning ring of fire. I went down, 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 and the flames went high, and it burns, burns, burns. The ring of fire, the ring of fire. The taste of love is sweet when hearts like ours meets. I fell for you like a child. Oh, but the fire went wild, and I fell into a burning ring of fire. I went down, 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 and the flames went high, and it burns, burns, burns. The ring of fire, the ring of fire, and it burns, burns, burns. The ring of fire, the ring of fire.